What I'm presenting this evening is part of my PhD research on suicide and life-threatening behavior amongst trans people in South Africa. I've interviewed nearly 30 people over the past 5 years. As a classic grounded theory study, I followed the data to issues around gender-affirming healthcare because it is, well, life-saving. During the research, an important area of inquiry emerged. What are healthcare providers' experiences of providing gender-affirming healthcare? So in the past couple of months, I interviewed more healthcare providers, 2 medical doctors, 2 psychiatrists, and 4 psychologists. The clinicians had a wide array of experience in the field. Some were young graduates with only a few years of experience, and others had been providing gender-affirming healthcare for over 2 decades. They worked across the private and state sectors in clinical, research, and educational settings. One participant was black, the rest were white. 5 of the participants were queer, including gender fluid and as gay as the day is long. On that note, I too am queer, trans, non-binary, and a clinical psychologist. I go by they, them. Many trans and gender diverse people report having endured ill treatment, gatekeeping, and discrimination in their pursuit of gender-affirming healthcare in South Africa. Therefore, they are understandably careful when accessing and selecting healthcare providers. Providers who consider themselves allies can find themselves in a predicament when balancing the aspiration to provide person-centered and affirming healthcare with concerns about the potential consequences should they make a mistake, hesitate, or refer. Historically, healthcare providers have little to no training in gender-affirming healthcare, so aside from openly transphobic ones, many want to help but don't know how. Should they decline, the consequences can be harmful to both the healthcare provider and the client in dire need of gender-affirming healthcare. Participants spoke of challenges they faced while balancing their sensitivity to transphobia and responding to the needs of patients with a desire to provide ethical, affirmative care within the bounds of legal prescribing guidelines in South Africa. Themes emerged around healthcare providers' knowledge, experience, and training in gender-affirming healthcare and misconceptions around safekeeping, gatekeeping, and blacklisting. They articulated a desire to provide patient-centered healthcare, but also wanted to feel assured in their decisions around their clients' readiness for gender-affirming healthcare, in particular hormones and surgeries. This often meant consulting with colleagues to confirm whether a client is psychologically stable to start hormonal transitioning. This is a point of contention in the field, weighing up the stress associated with transitioning with the relief hormone therapy provides. The consensus is for mental health issues to be treated concurrently and as far as possible for cross-profession consultation. As one psychologist in the field said, these decisions are so big it felt like so much pressure to be part of this process and have the weight of the expert role, whether I see myself as an expert or not, but that was the role I was assigned. Another participant added, although we argue very strongly that many GPs can do the mental health assessment part of the process before you start the hormones, not all GPs feel comfortable, and we don't want the GP to be out of their scope of practice. The problem arises when GPs refer their clients to the state's gender-affirming healthcare services, specifically the transgender unit at Groote Hospital in Cape Town. The unit often receives unnecessary referrals from healthcare providers in the private sector who are seeking reassurance that they're doing the right thing, not because of the client's presentation, but because of their lack of confidence in their own practice. These services already have lengthy waiting lists, and inappropriate referrals take up space for others to be seen. As it stands, the unit's waiting list for gender-affirming surgery is over 20 years. Time for hormone therapy has significantly improved in recent years as they have streamlined their processes, but for some clients who are desperate for hormones, they experience these waits as personal rejections and attribute it to transphobia and gatekeeping. A doctor explained, "It is not intentional gatekeeping by individual practitioners, it is the system that is so resource constrained." They added that it is an issue of distributive justice. It is a very unfair system that people in private have much easier access to care generally and to gender-affirming healthcare. After the stringent COVID lockdowns in 2020, there were significant delays in our public health sector across all disciplines, with a backlog of thousands of essential surgeries. For context, at the point of research, the waiting list for cancer surgery stood at 600. Participants expressed anxiety about being labeled transphobic or offending their clients because of inappropriate language use and uncertainty about the correct use of terms for gender and sexual identity. Healthcare providers describe clients as being so forgiving, so patient, so humble, and as one psychologist said, the actual patients who are going through the transitioning process have done so much research themselves that they often educate me. Another added, "This was going to be a journey for both of us to explore, understand, and make sense of together." There was some reflection on whether it was appropriate to expect this of their clients, that some clients may be playing along out of fear of not getting care, but the reality is that the ongoing education of healthcare providers is a necessary frustration for all. For some, not being the knowledgeable doctor who is providing specialized care was intimidating. A participant said that the doctors are the experts and the gatekeepers because that has been their training, and so to see the person in front of you as the expert is like a dereliction of duty. Not having adequate training, knowledge, and experience was a significant part of why practitioners shy away from gender-affirming healthcare. For the participants, however, they did not see this as the real issue, but rather how they felt about and managed feelings of inadequacy. One stated, "It was important for me to first acknowledge and be okay with that I don't know." They describe lifelong learning requiring a degree of tolerance of feelings of inadequacy, which encourages them to continue learning. So rather than refer their trans clients to experts, as another said, "I just decided to upskill and sought organizations and other healthcare providers for support." The majority of the psychologists initially thought that their responsibilities were to do lengthy psychological assessments and diagnostics. They considered their formal education to be discriminatory and pathologizing of gender diversity. The focus was on the diagnostic criteria of gender dysphoria, or gender identity disorder as it was still taught for many. A participant quipped, "Thank God my memory is not that great, otherwise we would be in real trouble." The psychologists hypothesized that their colleagues may be reluctant to offer gender-affirming healthcare because they incorrectly believe it is about assessing capacity, certainty, and sanity. Some participants were dismayed with the misconceptions around gender-affirming healthcare, not only because their profession was ill-perceived, but because many trans and gender-diverse people were not seeking care because they believe they need to be convincing enough to receive it. In reassuring their patients of the collaborative nature of gender-affirming healthcare, they would tell them, "This is not an interview on your transness," or as another doctor said, "We are just here to hear your story, not give the stamp of approval." A participant thoughtfully explained, "The anticipatory aspect of the minority stress model where people have internalized this thing of, 'I am going to get bad treatment,' and then they see this thing before they have even walked into the consulting room. They interpret things through that lens, even if it is not intended transphobia." All of the participants were committed to upholding their clients' rights to self-determination, but were still conscious of their privilege and power. As a doctor bemoaned, "I am the gatekeeper with a fucking signature." This sat uncomfortably with them. A doctor felt so strongly about ensuring access to gender-affirming healthcare for their clients that they were hard-pressed to delay hormone therapy, even though there was a medical reason to delay. As a participant stated in reflecting on the gender-affirming healthcare guidelines, it is about balancing the individual's right to access care and the practitioner's responsibility to do it safely. Participants shared nuanced opinions on the trans community's efforts to protect itself from harmful healthcare practices. This is a community who has been so traumatized, especially by our profession, one reflected. Trans online communities are a common place for people to share their experiences of gender-affirming healthcare and give recommendations. Some of these include who not to see. Participants stated that while they don't support blacklisting or cancelling healthcare providers, one explained they appreciate that such actions are powerful tools and it is a way in which oppressed communities and forums actually navigate their worlds. But another participant was dismayed that there are people not seen to create safe space. The majority of participants who were knowledgeable and confident in providing gender-affirming healthcare were supportive of colleagues who were trying and called for compassion and understanding. Nevertheless, a number of healthcare providers were also reluctant to refer to colleagues they did not trust to provide patient-centered, gender-affirming healthcare. Many contacted colleagues to formulate a list of referrals. As a doctor asserted, "I don't want my clients to encounter anyone who is not on board." Healthcare providers new to the field but invested in it were most concerned about their reputation in the trans community and wished that they would rather be made aware of their misgivings so that they could do better. They mentioned clients not returning for appointments and not knowing why, and how they wished they would get feedback so that they can learn. None of the healthcare providers interviewed were aware of any healthcare providers being sued by clients, but sympathized with their colleagues who were concerned about potential medico-legal implications. The South African National Essential Medicine List Committee approved gender-affirming hormones for the tertiary sector in 2019, but have yet to do so for primary healthcare. Naturally, a concern for healthcare practitioners have been around the legality of prescribing hormones for so-called disorders off the book. Despite this being the case for many disorders, it was especially worrying that clients who may have regrets later, or parents unsupportive of their children transitioning, would use this as a reason to take legal action. With that said, the participants weren't really worried about being sued and said that South Africa didn't have a litigious culture, but believed that the possibility discourages their colleagues from working with trans clients. One sarcastically laughed that it is because we don't have the money to take each other to court. In addition, there is a general lack of confidence in the statutory bodies to timeously and effectively resolve complaints against healthcare providers. And on the topic of potential of treatment regret, the people who I interviewed did not see it as an impediment to treatment. As one GP noted, "It is not my job to ascertain how someone will feel in 20 years' time." The field of gender-affirming healthcare is in a very groundbreaking phase of its development. South Africa's first guidelines on gender-affirming healthcare were only published in 2021, and the only organization to support healthcare providers in gender-affirming healthcare, PATHSA, is but a few years old. So, as a participant pointed out, the professionals who provide hormones are othered in their professions. They are marginalized because it isn't mainstream yet. When it comes to gender-affirming healthcare, an understandable form of protectiveness has emerged to resist transphobia, gatekeeping, and inadequate care. Healthcare providers who are allies need to weigh up competing tensions between clients' needs and their own medical knowledge. They do this dance in a rapidly evolving political landscape where the practice guidelines and prescribing laws in South Africa have not kept pace with global trends and best practice guidelines. Many healthcare providers appear to be sensitive to the needs of transgender clients, but feel ill-equipped or apprehensive about providing care while ensuring their own standards of care, reputation, and practice. However, what healthcare providers find especially frightening is not simply their feelings of inadequacy, but their beliefs around gender diversity. Gender-affirming healthcare demands an internal reckoning with one's own gender, how it sits in relation with other genders, and the socio-political construction of these genders. An unforeseen project for clinicians trained to keep the personal out of the professional spaces.